Welcome to the 2022 Open Enrollment Informational Session for Departmental Human Resource and County Personnel Officers. Today we will be highlighting some very important information regarding this year's annual open enrollment. This presentation is a brief summary and does not constitute a legal document or contract and is subject to change. Topics for today include open enrollment, important dates and form submission deadlines, online resources such as COVID-19 coverage, virtual fair, and other EUTF website resources, plan changes, health plan benefit and premium contribution changes, health plan selection, know what to consider when selecting a health plan, enrollment form, completing and submitting forms for open enrollment, and money-saving tips and wellness programs. Identify ways to reduce cost and stay healthy. Open enrollment. Important dates. The open enrollment election period is from April 18th through May 13th, 2022. Employees who wish to enroll or make changes must complete and submit an EC1 enrollment form and any required supporting documents to their Departmental Human Resource Office, County Personnel Office, DOE EBU for DOE employees, or enrollment designee. For employees who do not want to make changes, no action is needed. Departmental Human Resource Offices, County Personnel Offices, and DOE EBU must submit open enrollment forms and required supporting documents to the EUTF by May 20th, 2022. Please submit documents via Axway electronic submission, by mail, or delivered by courier only. Faxed open enrollment forms will not be accepted. Enrollment forms received on or before the deadline will be processed during the months of May and June. Once the enrollment is processed, a confirmation notice will be mailed to the employee. If the employee does not receive a confirmation notice by the end of June, they should contact the EUTF. If the employee is not enrolling or making changes during the election period, they will not receive a confirmation notice. The new plan year for active employees begins July 1st and continues through June 30th of the following year. All changes made during open enrollment will take effect July 1st. Any health plan changes, including new premiums and rate changes, will also take effect July 1st. Premiums for the new plan year will be deducted from paychecks for state employees starting July 20th, 2022, and for county employees, July 15th, 2022. Online resources. Visit our website at eutf.hawaii.gov to get the latest information on COVID-19 coverage, learn about health service options, coverage for COVID-19 related services, and how to seek health services. This year we're hosting virtual open enrollment fairs instead of in-person informational sessions. You can attend virtually through your laptop, tablet, or PC. The EUTF Virtual Fair gives employees access to the same information normally available at our open enrollment informational sessions, but from the privacy and safety of their workstations or homes. Click on the latest information on health plan enrollment, health plan benefits, upcoming changes for the new plan year, attend live webinars, watch informational videos from each of the health and life insurance carriers, and access important open enrollment forms and documents. Website Active tab. Under the Active Employee tab, browse through links on our open enrollment checklist, enrollment forms, our Employee Health Benefits Reference Guide, current and new plan year premiums and contributions, our premium calculator to help you calculate the total of your plans for the year, and Plan Finder, which helps identify which plans you're currently enrolled in. Health and Wellness tab. The Health and Wellness section of the EUTF website offers various health and wellness resources, wellness challenges and webinars, virtual wellness fair, Well-Aware quarterly message, health topics and employer resources, and wellness resources from our health insurance carriers. Thinking of retiring soon? Our pre-retirement informational session gives important information on enrolling in EUTF retiree plans, Medicare Part B premium reimbursement, base monthly contribution calculation, health plan options for retirees, required forms and documentation, and offers a question and answer session at the end. Plan changes. HMSA plan changes are as follows. Increase the extended care facility benefit limit from 100 to 120 days per calendar year under the HMSA HMO plan effective July 1st, 2022. Added the Accordant Care RARE program, which provides one-on-one regular telephone consultations and coordinated care from registered nurses and other clinicians to patients managing certain rare, complex, and chronic conditions to all EUTF and HSTAVB active plans at no cost to the member, effective January 1st, 2022. CVS Caremark plan changes include added the RX Savings Plus program, which is a discount program where members can get additional discounts on certain non-covered drugs effective July 1st, 2022, EUTF and HSTVB members. Added prior authorization and quantity limits effective July 1st, 2022 for Opzelura, which treats atopic dermatitis, and eye drops used to treat presbyopia or farsightedness, such as Vuity, EUTF members only. Expanded the age limitation for colonoscopy prep prescription drugs to ages 45 to 75, effective May 1st, 2022, in accordance with federal law, EUTF and HSTAVB members. Added the Drug Exclusion Plan Design Program, which excludes targeted drugs with little or no clinical value, effective January 1st, 2022, EUTF members only. Added utilization management such as prior authorization, step therapy, and/or quantity limits for the following drugs or classes. Acthar treats infantile spasms, Afrezza treats diabetes, Mupirocin treats bacterial infections, omega-3 fatty acids treats hyperlipidemia, Palforzia treats peanut allergies, products for migraine, neuralgia, psoriasis, and rosacea, and topical corticosteroids effective January 1st, 2022, EUTF members only. Added prior authorization and quantity limit requirements for ivermectin, treatment for parasitic infections, effective October 14, 2021, EUTF and HSTAVB members. Premium rate changes. For information about the 2022 to 23 monthly premium rates that take effect July 1st, 2022, visit the EUTF website at eutf.hawaii.gov and look for premiums and contributions. Health plan selection. When selecting a health plan, there are a few things you want to consider. Premiums are the monthly amount paid for your health insurance shared between the employer and the employee. You will want to consider the premium amounts of the plans you're selecting. Deductibles. Consider whether your health plans have services subject to a deductible and be sure you understand how they work. Deductibles do not apply to all plans or all services. They cannot be paid in advance and are renewed annually. Deductibles must be paid each calendar year on a claim-by-claim basis before benefits subject to the deductible become available. UTF benefit renewal is based on either a calendar year or a plan year. A calendar year runs from January 1st to December 31st. Plan year runs from July 1st to June 30th. Plan year benefits include dental and vision benefits. UTF members experience a higher level of benefit when they receive service from in-network providers, including in-network physicians, hospitals, pharmacies, and other providers contracted with your health insurance, although some UTF coverages offer out-of-network benefits. These are providers that are not contracted with your health insurance carrier. The benefits are almost always lower than when you see an in-network provider. To maximize your benefits under your UTF coverage, you'd want to see in-network providers. Coinsurance and copayments. Coinsurance and copayments represent your out-of-pocket cost for covered expenses. Coinsurance is your out-of-pocket based on a percentage. Copayments are out-of-pocket costs based on a fixed dollar amount. Maximum out-of-pocket is the maximum amount of coinsurance, copayments, and deductibles you will pay for covered medical and prescription drug costs within a calendar year. The maximum out-of-pocket is your financial protection against a catastrophic injury or illness. All covered coinsurance, copayments, and deductibles apply towards the maximum out-of-pocket. Starting at the beginning of the calendar year, your insurance keeps track of all of your out-of-pocket coinsurance, copayments, and deductibles that you've paid out. Below are the maximum out-of-pocket amounts for HMSA, Kaiser, and CVS. Please note the differences between each plan. When the maximum out-of-pocket limit is reached, covered services thereafter will be covered at 100% by your insurance for the remainder of the calendar year. Members are still responsible for taxes and other non-covered services. The benefit resets every calendar year. The following are some examples to help clarify some of the terms that we've gone over. Rick is considering either enrolling in the HMSA PPO 9010, 8020, or 7525 self-only plan. Here are the annual premium amounts, which is the monthly premium multiplied by 12 for the 9010, 8020, and 7525 plans. Rick anticipates 4 doctor visits during the calendar year. His doctor charges $100 per visit before his insurance pays, total $400. Under the 9010 plan, Rick's coinsurance is 10% or $40. Both deductible and maximum out-of-pocket do not apply. Total annual cost is the annual premium amount plus the 10% coinsurance listed at the bottom in green. Under the 80/20 plan, Rick pays a 20% coinsurance along with a lower annual premium amount, showing a lower annual cost if he selects the 80/20 plan in this scenario. The 75/25 plan has a 25% coinsurance in addition to a $300 annual deductible per person under the plan that must be satisfied before the benefits that apply to the deductible are paid. However, physician visits do not apply to the deductible. Therefore, Rick's total estimated annual cost under the 75/25 plan would be the insurance plus annual premiums, making the 75/25 plan the plan that offers Rick the most savings in this scenario. In our last example, Malia is considering enrolling in the Kaiser Comprehensive or Standard plan for herself only. The annual employee premiums are listed here. Malia will undergo surgery and was told the cost before surgery could be $50,000 at an in-network Kaiser facility this year. Under the Kaiser Comprehensive plan, Surgery and hospitalization are covered at 100%, so Malia will only be responsible for her annual employee premium and contribution. Under the Kaiser Standard Plan, surgery and hospitalization are subject to a 15% coinsurance, or $7,500. Malia will not pay $7,500 because the maximum out-of-pocket limit for self-only under the Kaiser Standard Plan limits her out-of-pocket to $2,500. Malia will be responsible for her maximum out-of-pocket and her annual employee premium contribution, making the Kaiser Standard Plan the plan that offers the most savings in this scenario. MedQuest, Hawaii's Medicaid program. If employees or their dependents are currently enrolled in both MedQuest and UTF health benefit plans, they are likely paying premiums for additional healthcare coverage with little, if any, added benefit. Employees may want to consider terminating their UTF health benefit plans during open enrollment. If their MedQuest coverage ends, they have 45 days from the date of the termination notice from MedQuest to enroll in UTF health benefit plans. Coverage under the UTF plan would be effective from the date MedQuest coverage ended. Enrollment form. Enrollment submission form. Employees that wish to make changes during the open enrollment period must submit an EC1 or EC1H enrollment form. Please ensure the employee has submitted the correct form and all applicable sections are complete. Employees must submit forms and all applicable supporting documents on or before the May 13th deadline to their Departmental Human Resource Office, County Personnel Office, DOE EBU Office, or Enrollment Designee. Required supporting document submission. Please ensure that employees that are adding a spouse, partner, or dependent child submit required supporting documents along with their open enrollment forms. If they're adding a spouse or partner, they must submit a marriage certificate. For domestic partnership, a notarized declaration of domestic partnership, affidavit of dependency and acknowledgement, and 2 sets of required verification documents. Visit utf.hawaii.gov for more information. If they're adding a dependent child, they must submit a birth certificate, guardianship decree if legal guardian, adoption decree if child is placed for adoption or adopted. Dependent children aged 19 to 23 who are full-time students and enrolling in dental and vision plans must submit a student certification letter, a letter from a school's registrar, or a verification certificate from the National Student Clearinghouse. Transcripts and class schedules are not accepted. Enrollment forms and all required supporting documents must be submitted to the employer's open enrollment designee by May 13, 2022 for changes to be effective July 1, 2022. If required supporting documents are not submitted by May 13, 2022, dependents' enrollment request will not be processed. Submission deadline for enrollment forms and all required supporting documents to the UTF by Departmental Human Resource Offices, County Personnel Offices, DOE EBU, and Enrollment Designees is May 20th, 2022. Please forward forms and required supporting documents to UTF as they are received and do not hold them to send all at once. Submit forms to the UTF electronically through Axway, by mail, or courier only. No faxing of open enrollment forms. The UTF office address is 201 Merchant Street, Suite 1700, Honolulu, Hawaii 96813. All non-open enrollment related enrollment forms may be faxed to the UTF. Confirmation notice. The EUTF will send the employee an enrollment confirmation notice after the processing of open enrollment forms is completed. If the employee does not receive a confirmation notice by the end of June, they should contact the EUTF. If the employee is not enrolling or making changes during the election period, they will not receive a confirmation notice. Money saving tips and wellness programs. Tips on how to save money. With healthcare costs continuing to rise, here's some tips on how you can save money. Choose the best plan for your needs. Not all plans are created equal. Just because a plan has the highest monthly premium does not mean it will be the most cost efficient. Be sure to factor in your cost share, deductible, co-insurance and co-payments, monthly premiums, calendar year maximum out-of-pocket, and expected usage for the year before making any plan decisions. Every year, open enrollment offers an opportunity to choose a plan that best suits your needs, which may change from year to year. Pick the right facility. The ER should be reserved for serious emergency situations. If you have a non-emergency illness or injury, go to your regular doctor or urgent care facility. Cost savings can be significant. For example, the total cost of an office visit is around $100, while an ER visit could cost $1,000 or more. Other options for care include Kaiser Permanente or HMSC's online or telephonic care, and walk-in clinics such as urgent care or the CVS Minute Clinic. Choosing generic when available. There are a number of ways to save money on your prescription drug costs. One of the most cost-effective ways is to ask your prescribing doctor if you can take a generic drug. Taking a brand name drug over a generic can end up costing you 3 or 4 times more. For example, if you are on Zetia or Vytorin to lower cholesterol, ask your prescribing doctor if you can switch to ezetimibe, simvastatin, or another generic. Doing so could save you up to $300 annually per prescription. Additionally, these changes could potentially save the EUTF hundreds of thousands of dollars annually, which helps to lower plan premiums. Another great way to save money is by switching to mail order. In addition to saving money, mail order offers the added convenience of receiving your prescriptions at your doorstep, saving you time and money by not having to make regular trips to the pharmacy. HMSA and CVS members call CVS customer care toll-free at 1-855-801-8263, visit caremark.com, or download CVS Caremark's mobile app at the App Store or Google Play. While online, you can easily check the costs of your medications by using the Check Your Drug Costs tool and comparing your current prescription to other low-cost alternatives. Share this information with your physician to see if any of the lower-cost alternatives are appropriate for you. Kaiser Permanente members, if you have not done so already, you'll need to register for a secure kp.org account in order to refill prescriptions online. You may also set up mail order services when you visit Kaiser Permanente or call the number on your prescription label. The EUTF encourages you to be well, be strong by taking advantage of the wellness programs available through your health plans. Getting your annual physical exams and screenings can help with early risk detection of illness and disease. If you're thinking about quitting smoking, our plans offer tobacco cessation products and programs, including telephonic counseling to help you kick the habit. Disease management programs help EUTF members that suffer from chronic conditions find information, support, and programs that help members better manage their conditions. Health coaching is available to help members start an exercise program or who would like help with meal planning or eating healthier. Health risk assessments are available online to members to help begin the process of getting healthy and staying healthy. Reminders. The deadline for employees to submit EC1 and EC1H forms and all required supporting documents is May 13th, 2022. All changes will take effect July 1st, 2022. For employees who do not want to make changes, no action is needed. Deadline for employers to submit forms to EUTF is May 20th, 2022. Open enrollment forms and required supporting documents must be sent through electronic submission via Axway, by mail, or delivered by courier to the EUTF. No faxing of open enrollment forms and/or related supporting documents. This concludes our presentation for today. We hope our presentation was informative and helpful. On behalf of the EUTF, mahalo for your time and attention.